Om Shanti. Welcome to the pranayam class.
Om Shanti. Namaste, ma'am.
Namaste, dear. My voice is clear to everyone?
Yes, ma'am. Yes.
Okay. Now, let's start the session with the prayer. Keep your back, neck aligned. Bring the alignment to your back, your neck, your shoulder, and gently close your eyes. Observe your asana and correct your alignment, adjust your alignment. Now, bring your awareness towards your natural breath, how the breath going in and coming out. Now, take a deep, prolonged, slow inhalation, deep, prolonged, slow exhalation. Inhale and exhale with conscious mind. Now, take a deep, prolonged inhalation for the Om. Inhale deeply for the Om. Shanti, Shanti, Shanti. Feel the vibration and sensation. Now join your both palms together. Rub your palm. Place on your eyes. Very slowly while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. Now, in previous class, we discussed about it, the abdominal breathing, right? Abdominal breathing we practiced. Now, today we're gonna learn the new technique of the breathing, that is the thoracic breathing. So write it down, thoracic breathing, and then I'll explain you. So thoracic breathing, the chest breathing, another name is a chest breathing, where you inhale, you concentrate around your chest area, the upper part of the torso. And this area, as you know, is, there's lung, there's heart is located and protected by the rib cage. And upper and lower respiratory system you are working on it when you are practicing the thoracic breathing. This thoracic breathing is, play very important role, especially when people are having any problems related to the lungs and problem related to the kapha related things. Remember in therapy class, in Ayurveda class, I talked about it. Kapha location is mostly here, right? Upper respiratory system and lower respiratory system, you get the most of the problems. So when somebody practicing the thoracic breathing or chest breathing, he's basically preventing these kind of problems. So inhalation and exhalation, you are working on your upper respiratory system like your nostril, your trachea, your, sinus. These are the upper respiratory system part. Then lower respiratory system, your bronchitis, right? Your bronchi, then alveoli and your lungs. These are the lower respiratory system. These area would be strengthened by doing the chest breathing. So whatever problems related to these area would be, quickly healed if somebody is having that. So bronchitis, tonsillitis, sinus, or inflammation in the lungs, even in COVID situation, right? In COVID-19 virus is basically affecting the lungs. So it's more kind of pneumonia kind of situation for the people who are suffered from the COVID-19. So it find out like there's many experiment going on related to the chest breathing and abdominal breathing. Even this is my personal experience also. When I got the COVID, I was practicing the chest breathing and abdominal breathing, and also I taught my mom that she has to do the chest breathing and abdominal breathing, both breathing, simultaneously. If you're practicing, you get lots of benefit, and you strengthen these areas, these body parts, and your organs would be strengthened and function more efficiently, more in proper way. And you're not dealing with the lack of the oxygen, and your oxygen saturation would not be drop out. It remain on the in accurate rate. So this is my personal experiment which I did on myself and on my mom. So I find out these two breathing is very, very tremendous benefit having it. Just by practicing these two breathing, many problems you can prevent. Even modern doctors are telling you that go into the prone position and do the more chest breathing, breathe from the chest, right? If you see the news channel and everywhere, doctors are making the video on that. Reason behind of it, because they also know that if somebody is concentrating and when they are breathing with the lungs get more a circulation of the blood. And once the lungs get more circulation of the blood, the muscles of the this involuntary muscles of the lungs would be strengthened automatically. So these muscles would be, smooth muscles would be, gonna be activated and function in a proper way. So chest breathing, abdominal breathing, everybody, I think everybody, there's no major precaution at all. all kind of people can practice. Any problem somebody is having, uh, either dementia, memory loss, lack of the concentration, or even they lose the, sometimes people get the, a problem related to the eyes, problem related to ear, or any kind of problem related to the, any part of the body. You can easily tell them, okay, go for the chest breathing and abdominal breathing. As I keep telling, abdominal breathing play very important role, right? So along with the abdominal breathing, if somebody is practicing the chest breathing, thoracic breathing, and they enhance the oxygen level in the body, and it's not on the, these respiratory system gonna strengthen, but cellular respiratory system cells also have the, the exchanges of the gases going on. um, when each cell of your body take the oxygen, particles, and release the carbon dioxide, that is exchanges of the gases happening in the cellular level. Okay, that called the cellular respiratory system is also strengthened, and you're going to increase the life of the cell, and you delay your old age and most of the things. So chest breathing have tremendous benefits, as I keep telling you. There's no major precaution at all. And position, best position, yes, again, sitting position. You can practice the chest breathing in the Vajrasan, Padmasan, Ardha Padmasan, Swastikasan, Siddhasan, Sukhasan, and many more posture, right? All the meditative posture and sitting posture is ideal for the chest breathing. But yes, chest breathing also can done on the prone and supine position both way. So prone and supine position, you can do the chest breathing also, and abdominal breathing also you can do in the prone and supine position. I'll give you the assignment related to that at the end of the session. Don't worry. So these position you can also implement, but when you're gonna implement to your student when they are unable to sit, when their oxygen levels is quickly gonna drop out, or they are suffering from certain kind of breathing, shortness of the breath, that time you gonna give the prone or supine, basically the prone position for them. Immediately when you give the prone position, the expansion of the lungs, wider, and they get more oxygen into their lungs. So that's why prone position is ideal. But in that condition, when somebody suffering from the fatal disease or any lungs related problems, okay, otherwise they have to sit and do the practice of chest breathing and abdominal breathing. Now, idle time, again, idle time is the morning time, but again, every meal, whenever somebody is having any meal, they can go for the chest breathing. Before having any meal, they can do a little bit chest breathing, 10 to 15 minutes. So major problem related to the digestive disorder would be cured when they do chest breathing before having any meal. So abdominal and chest breathing go hand to hand together, because you're going to increase the benefit. Major location of the like heart is located around your lungs, in between the lungs, and major other body parts, organs are located into your abdominal cavity. So both breathing is play very important and crucial role. And it's also correcting your breathing pattern, because in modern world people doesn't know how to breathe, and they are doing the handstand. I've seen people, they are very good at the posture, they are doing handstand or headstand and other things, but they don't know how to breathe, how to relax their tongue during the breathing, and they're doing the inversion posture. If you don't know how to breathe in and breathe out, and you are doing the inversion posture, your blood circulation, you are soothing your blood circulation. It means you are soothing your blood circulation. Immediately your blood, increase, the blood flow increase, and you get the hypertension, and there is a high chances that people get the stroke when they are practicing the inversion posture. So nobody's, telling this thing. I'm quite afraid about it. I don't know why people doesn't know that before practicing the inversion, semi-inversion, because blood circulation immediately go towards your head. And this is the not natural posture of your body. You always stand, blood go from top to the towards the leg, right? This is the natural procedure. When you're reversing this thing, immediately blood go towards your brain and towards your heart, and there's high chances that might you get high blood circulation and hypertension immediately, and you might get the stroke, and maybe you get nervous breakdown or something else. There's a many disorder, come to those people who does not know how to breathe in and how to breathe out during practicing the inversion. They are doing out of fun, and it's very dangerous practice, especially headstand when pressure is here, right? And major pressure come to your your cervical area, your vertebrae, the neck vertebrae. So very much important. First, you have to introduce your students the breathing, so their body relax whatever the posture they are attempting, especially the difficult posture, inversion posture. When they are reversing the blood circulation in their body, that time they know how to breathe in and how to breathe out. Any doubt till here?
Yeah, I
Am I
want to
clear
know
to
what
everyone
is.
before introducing difficult posture? Yeah.
Yeah, I wanted to know what is the correct procedure of breathing while doing inversion postures.
What?
You
What
just
you saying?
you're talking about the inversion postures, the
Yeah.
correct way of breathing during inversion postures. So I just wanted to know that.
The correct way I'm telling you, I'm teaching daily in the class. I'm teaching you how to breathe in, how to breathe out, like how you do the abdominal breathing breath, right? Now today we're gonna learn the chest breathing. Tomorrow tomorrow is off. Monday we're gonna learn the yogic breathing. So eventually it's come to you. There's no trick applied, right? Because many people they are not aware about it and they train into the wrong pattern. And if it's not quickly, they're gonna reverse it. It's required the awareness of the mind, right? More you have to put the effort in inhalation and exhalation and correct the breathing pattern. Like when you inhale, your lungs would be expanded, your belly should be expanded. In yesterday class, I talked about it, right? How your lungs and your rib cage and your diaphragm move towards. This should be you are aware about it, and your belly pop out. You should be aware about it. How? So this, when you are aware about it, the the technique is automatically you are correcting it. But when the people who are not aware about it, like right now you're correcting it, but when you go into the actual posture, right, you're doing nothing, just sitting or watching television or something, again it's come back to the same habit pattern. So more you are doing it, more you are practicing the pre-practice of the pranayam, then eventually you're gonna correct it. Because 20 years, 30 years, or 40 years, you are doing the wrong habit. You set the wrong pattern, right, of the breathing pattern. It's not the 1 day, 2 day, or 3 day task. You correct it. It's required many months. Okay, it's required to correct. So when you are doing the involuntary action of the breath, like breathing, going on, coming out, even watching the television, it's corrected automatically. Because when you do with the awareness and you're training your mind, okay, I have to breathe in like that, I have to breathe it like that, my lungs would be expanded, my lungs would be contracted, my belly would be contracted during the exhalation, then eventually it's gonna implement it eventually, slowly, you know gonna implement it in your day-to-day activity. When you are not even doing the breathing with the effort, when you are not doing the voluntary breathing, that time, that time your breath pattern would be corrected. Right now you're putting the effort, you are correcting. But how long? Maybe 15 minutes, 20 minutes, but rest of the time you're doing the wrong breathing. So you have to pay attention towards it. Inversion posture come very later on, ones who correct their breathing, and it depends person to person, individually, according to your own pace, according to your own time. If now you can ask how much duration it required. It's depend person to person. It's like you have to consider yourself like a child. Again you start taking the breath. Have you seen newborn baby who come out from the womb of the mother, and first time he's inhaling and start crying upon it. It's very new thing. And then eventually he get on along with the inhale and exhale. Same way you have to consider now. It will take time, dear, according to your practice, according to your strong determination, according to your awareness, how conscious towards your breathing. That's why in meditation we are practicing anapan, which help you to correct your involuntary breath automatically, not force, not with the force, but you just observe it, right? And in pranayam, we are learning the breathing practice. So technique we are going on, right? Am I clear to you, dear?
Okay, yeah. So if we know correct way of breathing, then there is no issue if you're doing inversion postures.
No, I
That's what
that's
I'm
I
trying to understand.
yeah, just I just told you that if you are doing wrong breathing, there is high chance that you might get heart attack, you might get stroke, you might get, there's a chances. It doesn't mean everybody who is practicing the inversion, but there's high risk. Are you getting it? I just told you there's a high risk that might they get these kind of issue, might they get these kind of problem, because blood circulation increase when you do the inversion. Whenever
Okay.
you do the practice of inversion, your blood circulation gonna increase. To calm down your blood circulation, you require proper breathing. Are you getting it? So follow my words. Don't just misunderstand anything. I'm very much clear. Whenever you do any practice of inversion, your blood circulation increased. And to maintain it, you require normal breathing. So that's why I'm saying be very conscious whenever you're practicing the inversion posture. All kind of inversion posture, if you're practicing, be conscious about it, aware about it. How's your tongue should be relaxed, how's your breathing should be normal and calm. If it is not, it means you are harming your system. There's some kind of damage is awaiting for you, and people who are doing it, they get lots of kind of problem. That's why I'm saying, because of wrong understanding, people are getting into the, they are seeking the medical help, and they're blaming the yoga because they don't have the proper guidance, they don't have the proper knowledge. Just by watching the video, just by uh, I don't know, through the videos, through the something, they just attempted it look like a fun, but they don't know behind what happened actual in their body when they are doing certain posture. And even many teacher doesn't know about it. So it is not their fault, but because nobody is understanding the why we need to do certain kind of breathing in particular asana, why we required pre-practice of the breathing, and then we're gonna choose that one posture. But now modern world is completely different. But I think you are all are wise people. Use your common sense, okay, before practicing
Some example,
anything.
please.
Yeah, Jagriti.
Can you give me some example, please? Like
Oh.
wrong breathing in inversion.
Wrong breathing in inversion, it's automatically gonna happen to you. Just try it and you're gonna see your heart pulse go high, and you just get the shorter breath. It happens, shorter breath, you are getting it. You cannot do the deep inhalation because deep inhalation is very difficult when you do the inversion. So before that, you have to calm down yourself, relax yourself, strengthen your upper part of the body. Your hands should be strengthened, these area would be strengthened enough, and then try the inversion and practice these chest breathing, abdominal breathing more before attempting the any kind of inversion. Give the time your body to first they're gonna strength in your legs and then your arms. Once you feel you have the strength in your arms, you can do properly chaturanga, you can do the downward dog without having the pain, and upward dog without having pain in your arms. You can do the plank and you can hold the plank. It means your arms is very much can hold the the weight of your body. Then your lungs would be, your core would be also strong, because you have to breathe, your core would be completely squeezed. When you do the inversion, especially headstand and handstand, I think these things would be explained by the asana teacher. He will explain you whenever you are doing the inversion posture. But just my task, you have to focus on your breath. That's it. Just see your breathing should be long, deep, and it should be rhythmic. Try to make it rhythmic. Inhalation should be very long, deep, and slow. And exhalation, deep, slow, long. You are doing the purak inhalation. Okay. Rest of the things, whatever you are doing it, that is the wrong breathing during the inversion. Getting it, Jagrati?
Yeah,
So just check your breathing should be long, deep, and very slow. You're not just like that, you are doing it. You have to calm down your muscles whenever you're practicing the inversion. Am I clear?
yeah, very much.
Okay. So, um, so let's start practicing the chest breathing. Follow my instruction. There is no precaution, as I told you. Any meditative posture you can choose, uh, where your back remain aligned with your neck, your lower back, your middle part of the back, and shoulder completely relax. Rest your palm on the knee. Remove the glasses and gently close your eyes. Observe your asana first. Get into your pose, your asana. Surrender yourself to your asana. How's your back, your neck, your shoulder completely connected with your body? Observing how you are sitting. Be comfortable, completely relaxed within the posture, and contemplate, set the intention. At least 10 to 15 minutes, I'm not gonna move my body. Stillness is very much important for the pranayama and for meditation also. Set the intention that you are not gonna move your body 10 to 15 minutes, keeping your body completely still, no matter what's gonna happen around you. Just do not pay any attention towards it. Just remain to your ground, remain to within yourself, remain to connected with your body. And I'm not gonna move my body at all, any part of my body. The moment I choose the posture, I remain into that posture, maintain my stillness. Set the intention, take the pledge. Now, take very slowly, deeply, long, very prolonged inhalation and exhale. Inhale and exhale. Inhale and exhale. Before chest breathing, we're gonna practice few rounds of the abdominal breathing. So as you inhale, pop out your belly very slowly like a balloon. As you exhale, squeeze your belly in. The belly movement should be go with inhalation and exhalation. Inhale and exhale with the belly movement. As you inhale, belly pop out. As you exhale, belly squeeze in. Deep, slow, prolong. Inhalation, purak. Deep, slow, prolong exhalation, rechak. Keep practicing few more seconds. Awareness should be around your abdominal part, completely focused. Now, very slowly shift your awareness towards your lungs. Now, this time, relax your belly completely and place your left hand on your chest. It's just for the feeling how your lungs, how your chest is moved along with the breathing. When you inhale through your lungs and exhale through your upper thoracic area. So this time you're not paying attention towards your belly movement. You are paying attention towards your chest movement. Now this time, as you inhale, just feel the expansion into your lungs. Expand more, more, more. As you exhale, take out the air from your lungs. Inhale through the lungs. Exhale through the lungs, which you are doing with your belly later on. Now you have to do with your thoracic area through your lungs. Inhalation and exhalation. Now this time you have to consider your lungs become a balloon and you're expanding with inhalation. Expansion happen into your lungs, your rib cage. As you exhale, squeeze your lungs, contracted your lungs. You can feel that thing with putting your left hand on your thoracic area. You can feel the movement of the lungs when you inhale and exhale, how they are squeezing in and popping out, expansion and inhalation. Belly slightly moving, but you are not paying attention towards any part of your belly movement. The concentration should be shifted towards your thoracic area, your lungs. Each and every inhalation should be done with awareness. Allow your mind to connect with the each and every breath. If your mind is lost in the thoughts, again come back to your breath. This chest breathing is play very important role, and this is the pre-practice of the Bhastrika Pranayam. So you have to prepare your lungs for pranayam also. Keeping your back, neck straight, chin parallel, do not drop. Do not lose your body, do not lose your asana. Completely focus and concentrated on your inhalation, which is prolonged, deep, and very slow, and exhalation. Now take your own time to come back to your normal breathing. Take your own time. Now take a deep, prolonged inhalation. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale for the 3-time Om and Shanti. Take a deep, prolonged breath for the Om. Shanti, Shanti, Shanti. Join your both palm, wrap your palm. Please on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. Any doubt, any difficulty related to the technique which you don't understand?
समझ में तो आ गया, बट करने में एब्डोमेन कितना इजी होता था ना, इतना इजी नहीं हुआ ये.
हाँ, नहीं होगा. Initial level, it's very difficult to, breathe from the lungs. Abdominal breathing along with the chest breathing, when you are doing it, then how you're going to practice it? With lots of effort you have to put here. So lots of concentration you require to inhalation and exhalation should be going on through your lungs. But yes, as I said this is the assignment you for tomorrow class. Tomorrow we don't have session, especially my session would not be there. So 2 days you are having off for my class, but Saturday rest of the class is going on. So tomorrow you're gonna do 2 things. You're gonna absorb practicing abdominal breathing and chest breathing in supine and prone position. So lying on your back and lying on your chest. Supine and prone position. So supine is when you're lying on your back, and prone position when you're lying on your chest. Same breathing you have to practice, chest breathing, thoracic breathing, and abdominal breathing. So you're gonna make the notes like that. You're gonna submit this assignment. 1, you're gonna write it down the sitting position, and when you're practicing the thoracic breathing and the abdominal breathing. Okay, what is the difference between it? You need to find out. So it is a self-realization. You can mail me. Okay, I'll share you the mail ID on the WhatsApp. The Soumya ma'am gonna share you the mail ID. So Sunday you're gonna submit me this thing, and then write it. Make the another column for the supine position. Supine position when you're practicing the abdominal breathing and chest breathing. What is the difference you find out? Okay, and then prone position. Make the another column prone position and how, and mention abdominal breathing and chest breathing. thoracic breathing and abdominal breathing, what is the difference between it, and write it down your conclusion. Okay, which posture you find out more easy for you, not in general. Okay, so you're gonna write it down your own experience here, your experiment. This is a kind of experiment which you're gonna implement in three asana. One is sitting posture, second is prone, and third is supine. And figure out by yourself, do you find any difference between it, same benefit you will get, or same expansion is happening, how your lungs feel differently, and how your abdominal feel differently when you change the position, when you're changing the posture. Okay, that's you're gonna write it down in your assignment. So assignment is clear to you? Yeah.
Okay.
So very personal assignment. Okay, I don't want anything from the net. So personal experiment, you're gonna do it for tomorrow's session. And if you have still any doubt, you can ask me. Otherwise, we're gonna end our session here. Okay, so enjoy your 2 days off. Okay, and bless you guys, and keep practicing. More you are practicing, more you're gonna learn. This day is no shortcut, dear. You have to practice. Okay, and whatever I'm giving to you, this is the very important things, and this is the the basic of the yoga. And if your base is cleared, advanced thing is automatically gonna clear up of you, right? When base is strong, whole the foundation of the yoga structure would be strong, right? So make your base very strong by doing daily practice. Especially the breathing practice is very much important. It's make you uh, keep you ready for the next session. Bless you guys. Om Shanti Mangal Ho.
5 से 6, 5 to 6.
Yeah, meditation 5 to 6. Meet you at meditation class. Bye bye. Take care.